Welcome back. We got another one coming to you live with cracked teeth today, numbers 3 and 4. Patient reports with discomfort upon chewing, upper right side. We take a cone beam, rule out infection. We do percussion testing. We do endo ice testing. And then lastly, we use a tooth sleuth. So think of a tooth sleuth kind of like a stick that you bite on. The whole purpose of biting on it is to elicit, discomfort upon chewing. So if you're uncomfortable when you bite on the tooth and you're only biting on that tooth, it tells us that you have cracked tooth syndrome. So this is our pre-op. Now she's got veneers and crowns in the front, so that's why this looks a little funny. But if you look really closely, you're going to see some cracks here in this first bicuspid, and then you're also going to see a crack here on this first molar. So easier to see in the mouth, a little tough to see on the scan, but that's why we rely on our tooth sleuth there. So patient elected to do 2 full coverage crowns. It's going to help wrap those teeth together, help hold them into one piece. And of course, we can see how much posterior occlusion she has, so it makes sense that those are the teeth that would want to crack. Okay, so I've already had my assistant do some of this for me while I was running through hygiene and doing a filling. She has drawn our margin for us on tooth number 3. We're going to come behind her and just correct it slightly. Typically, what I tell my assistants is that I don't really ever expect them to be able to draw the margin because I'm the one who prepped it. I know where it is. Usually they do a really fine job, but in my opinion, the doctor that preps the tooth should also be the one who draws the margin. So we will finish doing that. Now you'll see here that I intentionally did not come down onto the root surface here. I much prefer bonding to enamel rather than cementum or dentin. There's really no reason to drop the margin that low. Aesthetically, we're not going to see it when she smiles. And preventatively, it's just better to have that margin sealed on enamel. Also more hygienic because she can just clean it with her toothbrush as opposed to it being on the big gum line. So margin number 3 is done. We're going to go to tooth number 4. We're going to draw this margin twice. The first time around, I don't care where it goes. It's just a circle around the tooth. Second time around, I'm going to tack it down precisely. You'll notice here on the buccal, we did drop that down pretty much to the gingiva so that it's going to look pretty when she smiles. On the lingual, I did intentionally leave it up further on enamel so it's easier to keep clean. Also less of a cosmetic concern there on that lingual margin towards her palate. Okay, that's good. Our insertion axis, we're going to try and keep both of these crowns parallel to the long axis of the neighboring teeth. We're going to try and keep them at the same insertion path, but we'll see what the blockout says. It's pretty good. Tooth number 3, I'm just going to apply the same view direction, check our undercoats. That one I'll move just a little bit to block out or to prevent that block out there. Okay, that looks good. Spacer. So as we've said in pretty much every video up to this point, I like 120 microns for my spacer. We're going to apply for similar restoration elements so that it will apply to both crowns 3 and 4. Click OK. Just check to make sure that it transferred parameters, and of course it did. We're going to get our initial proposal here. We may go back to positioning tab if we don't like our proposal. Let's just see what we get. All right, and here we go. So right off the bat, looks like we've got adequate clearance. So we're happy with that. Looks like occlusion could be dialed in a bit more. Let's just see where we're at compared to the old teeth. So it looks like we've reduced occlusion quite a bit. We're going to try and give her some of that back. So first thing we're going to do is get rid of these green spots. Normally I use a remove tool, form remove. I use spacebar to cycle between my tools. Just makes it easier for me. Shape circular here. I like my contacts to have double turquoise. So that's what we'll do. Shape circular. We're going to bring this up some. Better. All right, now where else might we want to give her a bite? Maybe on this cusp here. Let's just see where her opposing dentition exists. Yeah, so we're going to want to give her something here. And then on the bicuspid, see, we could here. Yeah. Okay, so she's got a nice transverse ridge there with some occlusion. She's got some on the cusp tips, the marginal ridge here. This should feel great for chewing. All right, so fissure height's adequate. Occlusion appears to be adequate. Contour. So that needs to come out some. Minimal thickness issue there, fixed. Do we like our proximal contacts? So this one I feel okay with. I may bring out this premolar slightly. I'll probably taper that in some with my smooth tool in a moment. This one I may bring out slightly. Okay, so contour looks to be okay. Also correct this here. Okay. Let's get rid of these upper teeth and check our contacts now. So that is much too heavy. And use our form smooth tool. We don't want any yellow in this contact. And this is also far too much green. So double turquoise, the blue color, I'm totally fine with. That's just light contact. I like to describe it as chef's kiss. It's just right. Okay. That looks better. Red is a no-go. So red down here at the gum tissue I'm not concerned about, but red in the contact, we will never get that seated. We're going to do some of it from that tooth, and then we're going to flip over to number 4. I'll take the remainder from this tooth. It's better. Here's our mesio contact to number 4 with tooth number 6. Excuse me, tooth number 5. It's better. Okay. So now we've got our contacts dialed in. It's looking normal. Preoperatively, she may have had a little more bicuspid here. I've still got my tip there, so I think I'm okay with that. Let's see what happens when she moves around. So we're going to generate our reticulator. All right, remove penetration. Yep. Goodbye. All right, now we get this new tool, functionally generated path. So let's see what happens when her jaw moves left, right, forward, and back. She has no interferences. Now we can look at that cusp. Do we want to make that cusp tip a little longer? Maybe we do. Maybe we do, just slightly. Let's see what happens. Thing here. Let's bring that down slightly. All right, so we've changed our occlusion just a little bit. Let's try the smooth tool, see if we can't get rid of some of this. Smooth tool doesn't work. I will use shape circular or form remove, but that worked well. Let's check our function generated path. We've got a little bit of an interference here. Let's use our form remove tool. That. Yeah. Check our proximal contacts one more time, just to be safe. That one I could almost bulk out just a little bit. Okay, tooth number 3. Okay. There you have it. These cracked teeth will be wrapped with crowns, stopping the propagation of those cracks so that when she chews, it will no longer hurt. Should work out well for our patient. I'm going to smooth this down just a little bit, since that was one of the areas that she had that cracked tooth. I'm okay. Thanks.
Is this on?
Yeah. Say hi.
No.
You're famous now. All right. That looks good. That was one of my hygienists, Jade. She's very sweet, but apparently shy of the camera, and that's okay. But yeah, I like streaming this stuff because otherwise, like, how would you know? How would you know what we do? I think it's cool. This is my favorite part of my day, is designing crowns. It's fun for me. I think it's a great service to the patients, and she's going to get, our patients get their crowns the same day. So I like this stuff. If there's anything else y'all want to see, please do leave a comment, and we'll do our best to oblige.